A torn ACL in a dog can be a devastating injury. When this unfortunate accident occurs, can a canine ACL be treated non-surgically? Or is surgery always necessary? Watching your pup suffer from a long-term injury can be absolutely heartbreaking. Some of us know all too well that long-term health problems and wear and tear on your dog can be draining physically and emotionally. Anterior cruciate ligament tears in dogs may develop as an injury that worsens over time, a sudden rupture, or a mix of both. Either way, ACL tears impair a dog's ability to walk and may be extremely difficult to treat. Since humans may have a torn ACL treated surgically or non-surgically, you might be wondering if a dog can recover from an ACL tear without a surgical procedure. In certain cases, dogs may be able to recover from a partial ACL tear without surgical intervention. However, several factors come into play, such as age, weight, breed, activity level, and genetics. If the tear is complete and the dog can't avoid surgery, non-surgical techniques can aid in the recovery process. Let's explore the various treatment options. As in humans, ACL tears in dogs may be partial or complete. However, unlike humans, canine ACL injuries are unlikely to be attributed to sudden trauma. The damage mostly occurs over time, starting as a partial tear and eventually becoming complete. Human ACL tears are usually associated with sports. For dogs, physically demanding activities may also play a role in the worsening of ACL injuries. Dogs who are not physically active may also be at risk of developing knee injuries if they are overweight. A dog's ligaments may become strained and even tear from carrying extra body weight, just as in humans. It's worth noting that certain breeds, including golden retrievers, Labrador retrievers, German shepherds, and Rottweilers, are more likely to develop ACL tears than other breeds. Also, dogs whose parents suffered these injuries are far more likely to experience the same. So, what about the symptoms of an ACL injury? How do you know if your dog is suffering? Predictably, a telltale sign that a dog has suffered at least a partial tear is lameness. The dog will not want to place any weight on the affected leg, instead walking with an awkward limp. Another symptom is fluid buildup and swelling around the affected area. If the injury is left untreated, the knee joint may become thicker and the hip and thigh muscles may become weaker due to overcompensation. Due to the physical discomfort of an ACL tear, dogs with this injury are unlikely to be running or even walking much. In some cases, they may be able to walk, but will be less willing to jump up on the couch or climb the stairs. If a dog has both an ACL tear and damage to the meniscus, their legs may make a clicking sound when in motion, and signs of physical pain will be obvious. So how is a dog's torn ACL treated? The extent of the injury will determine the best course of action, along with your dog's weight and age. There are many treatment options that can decrease pain, increase mobility, and prevent further damage. In many cases, surgery will be the first step, followed by various non-surgical methods to encourage healing. A great deal of research is being done to compare non-surgical and invasive procedures in regards to ACL tears. For now, veterinarians generally agree that surgery is effective in helping dogs recover from ACL injuries. If the dog does require surgery, there are different procedures the vet may use, and the cost will vary depending on the chosen procedure. The most popular procedures are tibial plateau leveling osteotomy, or TPLO, and lateral extracapsular suture, the latter being the more affordable of the two. TPLO is the more invasive of the two and involves adjusting the tibia and stabilizing the knee joint. This may cost up to $5,000, and larger dogs will have better outcomes with this surgery. In lateral extracapsular suture, a suture is placed under the skin and around the knee joint in order to provide support while scar tissue forms around the suture. This may cost around $1,500, although larger, more active dogs may experience complications from this surgery. In some cases, surgery may not be an option due to the price or the dog's age. Generally speaking, smaller dogs are more likely to recover with non-surgical treatment methods than larger dogs. It's still recommended that you consult with your vet, since at-home care for these injuries can sometimes lead to worsening of the initial injury. If your vet determines that the injury would be best treated non-surgically, here are some treatments they may suggest. The most important means of encouraging healing of an ACL tear in dogs is through rest, inflammation reduction, and pain management. The injury may not heal through rest alone, but limiting physical activity is a key component of non-surgical treatment and post-surgical care. Pain management alone will not cure an ACL injury, but medication and icing may help soothe pain and reduce inflammation. Depending on the severity of the injury, your vet may suggest different ways of lowering pain and inflammation. such as NSAIDs, laser therapy, supplements, or acupuncture. As we mentioned previously, overweight dogs are at a higher risk of injuring or tearing their ACLs. Although dogs who undergo ACL surgery tend to have better results than dogs who recover by non-surgical means, both groups have better overall results when they also lose weight. If you decided surgery was the best option, it's likely that the vet will want your dog to undergo physical therapy after the operation. Even without surgery, physical therapy may be suggested, but your dog will need an extended period of rest after treatment before this can happen. Physical therapy will take place in both the vet's office and your home, and your vet will teach you and your dog how to perform certain exercises, so that you don't cause further damage to your dog's leg. Considering ACL injuries in humans are different from those that affect dogs, support measures that humans use may not be effective for dogs. Even so, a brace may be a good way to provide support, and may improve your dog's ability to walk. Your vet may help you find a custom fit brace or orthotics for your pup. Generally, a stiffer brace is better, and your dog may need to wear the brace indefinitely. Okay, so after all this, you may be wondering how long recovery will take for a dog with a torn ACL. Well, the duration of recovery depends mostly on treatment. Generally, the best outcomes occur when surgery is chosen and followed by rest, physical therapy, and weight loss. Just know that if you're treating your dog's torn ACL without surgery, recovery time will be much longer, potentially months. Remember, your vet will help you decide which treatment option is best for your dog's injury. Surprisingly, one of the most frequently asked questions from pet owners is, what happens if I don't treat my dog's ACL injury? Will it heal on its own? Well, the short answer is no. If your dog's ACL is partially torn, it's likely that the ligament will tear completely without treatment. This will only lead to greater pain and loss of mobility for your pup. It's important to visit your vet and have the injury inspected so that the vet can determine the best option for you and your pup. Another commonly asked question regarding dog ACL tears is, what if I can't afford surgery? Almost all of us are willing to do anything for our dogs and their well-being, but unfortunately, expensive veterinary care may interfere. If you're simply unable to pay for surgery, talk to your vet about non-surgical treatment options. Care for your beloved pet in the best way you're able to. It's important to remember that your dog doesn't know anything about treatment options, and they will love you the same, no matter what you choose to do.